Hello, my name is Pullakhandam,
And my name is Shivam Patel.
and this is our research poster presentation on the importance of intimate partner violence screening in clinical settings.
Some background on intimate partner violence. Intimate partner violence, by definition, is any behavior and intimate relationship that causes physical, psychological, or sexual harm to those in a relationship. And this can be sexual violence, physical violence, emotional violence, or controlling behavior. A research study conducted in 2003 found that IPV caused $8.3 billion in damages. The calculation was based on mental health services, physical health services, and loss of productivity that IPV cost towards people. Despite IPV being prevalent in all genders, it mostly affects women. Nearly 70% of the deaths from IPV are women, and it specifically has a higher risk of targeting women who are in childbearing age. More importantly, it is also reported more highly in low-income single women. Some risk factors that put people at risk to IPV are low education, drug abuse, poverty, and experiencing violence at an early age.
Intimate partner violence is certainly a big issue, and it can result in a huge range of both physical and mental repercussions. So once again, women are mostly affected by this and face several short-term effects, including difficulty sleeping, physical injuries, but the long-term effects certainly are present as well. This can be present in the form of digestive issues like stomach ulcers that come from stress or irritable bowel syndrome. Migraines are very common, as well as PTSD and other mental health issues such as generalized anxiety, depression, etc. Children are also often affected, even if they aren't the direct victims. Just being witnesses is a huge issue for them because they have to face all of this violence, and so their bodies do undergo an incredible amount of stress. So there are several short-term effects associated with children, including increased aggression, difficulty concentrating, and difficulty sleeping. But the long-term effects are also present, as mentioned, for the women, including a weakened immune system, which creates lower physical health in general, depression, anxiety, PTSD. Often a lot of children face behavioral problems as they struggle behavioral problems such as alcohol abuse and substance abuse as they struggle to cope with the violence. So our policy recommendation is to conduct early and frequent screenings, which are the key to identifying intimate partner violence and referring affected individuals to appropriate care. These screenings should be integrated into basic levels of care for both children and women to ensure no one is left out, and there's frequent follow-up. So this is especially during well child visits, OBGYN appointments, perinatal care, and routine physical checkups. And these IPV screenings can be conducted by healthcare workers or appear as intake forms. Studies have shown that both are equally effective. So even hospitals that may not have the manpower for several in-person screenings can implement intake forms instead.
So as we try to push this policy recommendation, when we look at stakeholders, we see that with doctors and nurses, when we try to push this policy recommendation, we see that we have to train them to be able to deliver IPV screenings. And then when we look at nonprofits and social workers, we see that that is a tangential sort of support system that we can set up with victims of IPV as well. And when we look at hospital administration and state legislators, these are the more larger bodies that we're trying to focus on, trying to implement a sort of standardized screening practice. And as Kay mentioned with the patients, they're also coming into the hospital the most, specifically women, during the prenatal and postnatal stages of lives.
So the next steps for this project is to conduct interviews with hospital workers to see where they stand on intimate partner violence screenings, transcribe and code these interviews, and analyze and summarize findings to find out how to best conduct intimate partner violence screenings, how effective they are, and how easily they can be integrated into a hospital system, specifically Duke Health System.